regarding your bill.
Yeah, thank you, Chairman Brasso and Vice Chairman Tester and members of this committee for giving me an opportunity to speak at today's hearing regarding one of the bills that you're going to be hearing about today, and that's the Tribal Veterans Healthcare Enhancement Act. It provides a legislative fix to an unfair practice that's been impacting tribal veterans who receive care at both the IHS and the VA. And I would point out that there were efforts made under the Indian Healthcare Improvement Act to streamline and coordinate care for tribal veterans, but there's a lot of work that remains to be done. Currently, if you're a Native American veteran going to your local IHS and then requiring purchase and referred care services, IHS will refer you to the VA. Now, oftentimes what happens is a Native American veteran who accrues a copayment or copayments, depending on the medical condition, for the services rendered through the VA. Unfortunately, instead of the IHS being responsible for the copayment, the veteran, who in many cases cannot afford that payment, is left with the bill. Now, conversely, had IHS authorized the PRC services through a private provider, there would be no copayment for the individual. Now, by law, IHS can and does refuse PRC services to tribal veterans, and by doing so, IHS places the medical care cost responsibility, I should say, on the VA and ultimately the Native American veteran. The IHS and the VA in the Great Plains area recognized that this was an unfair practice that conflicted with our nation's trust obligations, and they sought to address this issue through a local memorandum of understanding in which IHS would pay the copayment costs and the VA accepted the payments. In 2012, this MOU was rescinded. Once again, bureaucrats thousands of miles away intervened with a one-size-fits-all approach that harmed Native American veterans. For over 3 years, I've asked the IHS and the VA to reinstate the local MOU and continue to work to improve coordination of care for Native American veterans. I should note that a nationwide MOU exists to provide for veteran services provided at the Indian Health Service. The national MOU states that its purpose is, and I quote, to establish coordination, collaboration, and resource sharing between the VA and the IHS to improve the health status of American Indian and Alaska Native veterans, end quote. However, over the last several years, I've continued to hear from several tribal veterans with limited incomes who have had their Social Security and/or income tax returns garnished by the VA for unpaid co-payments. These men and women who served our country deserve better than that, Mr. Chairman. And what gets lost in all of this bureaucratic shuffle and red tape are the individuals impacted by this arrangement, Native American veterans. These veterans, like all veterans, deserve our utmost respect and gratitude. These are men and women, Native Americans first, who then chose to serve the United States, and their sacrifices, coupled with the federal government's trust responsibilities, require us to remedy this situation. And that's what this bill would do. Simply said, it will ensure that the federal government upholds its responsibility to provide health care to our Native American veterans. The legislation will remedy conflicting federal law that is harming veterans and furthering the goal, and I should say, and further the goal of providing the best care possible for our nation's heroes. And so that's the bill, Mr. Chairman. Lastly, I just wanted to mention, I'd be remiss if I didn't, that the ongoing issues within the Great Plains area IHS. As of today, it's been 158 days since the Rosebud Hospital's emergency department has been open. 158 days. Now, in that time, there have been 6 members of the Rosebud Sioux tribe that have died while being transported to facilities up to 55 miles away. 6. 6 families are left wondering whether their loved ones would be alive today if the IHS had not failed in its responsibility to provide safe and quality care. This is a disgrace. And I look forward to continuing my work with you, Mr. Chairman, with the members of this committee on a legislative path forward. And I thank you, Mr. Chairman, and I know you've got a couple of witnesses from my home state of South Dakota here today that are going to talk about some of these bills, and I want to welcome them both here, both Mike Black, and Director of the Bureau of Indian Affairs, and then also want to recognize Roger Trudell, who's the chairman of the Santee Sioux tribe of Nebraska, and both great leaders and people that I've worked with, and will add greatly, I think, to the discussions that you have today on these important pieces of legislation. Thank you, Mr.